Case history number 3 is about dilated cardiomyopathy. Dilated cardiomyopathy is a condition when the heart main pumping chamber, that is the left ventricle, get dilated and has decreased ability in pumping the adequate amount of blood to the rest of the body. A great majority of dilated cardiomyopathy, the causes are unknown. Over the years, we heart doctors think it is most probably related to previous affliction by heart muscle-seeking virus infection, but this is not exact science. In my clinical practice, I do collect 1 or 2 cases of congestive dilated cardiomyopathy a month. Not that rare, but my statistics is skewed because as a cardiologist, this kind of problems do land up on my table. Notable among them is a Malay male lorry driver, 45 years old, when I saw him some 15 years ago with a big globular heart on chest x-ray, coming to my outpatient clinic with complaint of shortness of breath on mild exertion. Echocardiogram examination revealed reduced heart pumping action, in which the contraction, the left ventricular ejection fraction, was only about 25%. Normal LV ejection fraction for you and me is between 55 to 80%. He was then 55 years old and has 3 daughters who are now doctors, one of them in a specialist training program at the UITM hospital in Selayang. Every time I see him in my clinic, I tell him that he is the most successful lorry driver in the whole wide world. His left ventricular ejection fraction has climbed up to a decent 48%. Edi Warman, that is his real name. With success, one do not need to use a pseudonym. Would you like me to refer you to Sungai Buloh, Eddie? Because there is nothing spectacular with your medications, all simple and all freely available for free in a government hospital. His answer, biarlah doktor, di sini ada barakah, saya boleh bayar. This biarlah doctor has been going on for 13 years. It is simple people like Eddie that keeps me going all these years. Which reminded me of a patient I saw yesterday, and this is a digression from the subject. Not many patients actually. He came in for an executive profile, full examination, and the stress test by me was one of the profile. I was busy upstairs with my regular patient. I was late for 20 minutes. Doc, you guys treat us like animals. Blah, 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 blah. He stood on the treadmill with his arms akimbo, ready to fight. I read him well. I'm very sorry, Mr. Ding. This is totally unavoidable. I'm sorry. We do meet such characters in our daily practice once in a few years. After nearly 35 years of private medical practice, I thought of giving such young punk just a tight slap on the face. But he was lucky. I have a bad cold and was in no mood for confrontation. They are usually lawyers. The lawyer-doctor alchemy is a bad alchemy, I must say. Lawyers somehow feel life is always confrontational. 3 ladies with congestive cardiomyopathy on my follow-up over the last 5 years or so did extremely well. One is an insurance banker in her mid-40s who came shortly after losing her baby at delivery and presented with heart failure. I diagnosed it as peripartum congestive cardiomyopathy, that is, cardiomyopathy related with pregnancy. To make matters worse and cloud the issue further, she had dengue fever near delivery with platelet level around 12,000. With a left ventricular ejection fraction of only 12%, I had to ask a nurse to follow her whenever she went to the loo. At 12%, you can get cardiac arrest anytime or a bad fall in the toilet. 2 months down the lane, she was fully active in a job, and follow-up echo 6 months later was normal, alhamdulillah. The other 2 ladies in their 40s had tachycardia-induced dilated cardiomyopathy. The diagnosis was not apparent initially, but much later in their clinic follow-up, they came back with fast rhythm. i.e. supraventricular tachycardia, which clinches the diagnosis. I referred both of them to my junior colleague who did a radiofrequency ablation of the accessory pathways in their hearts, whereby they ablate or sort of burn the extra electrical cables in the heart. In layman's terms, these two ladies have an extra electrical circuit in their hearts, electrical cable system that get switched on for long periods of time. They are doing very well now, and their left ventricular ejection fraction are back to low normal. And there are young deaths as well. Mr. Rodrigo presented at age 41, a long-haul tour bus driver plying Penang KL route with a heart as big as a football. Left ventricular ejection fraction 18%. Lasted for a long 5 years. Miraculously driving until his sudden premature demise at home from a cardiac arrest 2 months ago. In the UK, I would be duty-bound to have his license taken off by informing the LVC. But in the UK, they have good social security as safety net. I knew what was coming, thus advised him early on to co-opt his son to start taking over the business from him. What is the role of heart transplantation in dilated cardiomyopathy, one may ask? It has a definite role, and IJN is the place for it, but 1 or 2 hearts a year with a few hundreds or thousands on the waiting list does not make a program. Cadaveric heart donor is still a rarity in Malaysia. So in my groups of patients, I prepare them and their families early for possible premature demise, and I do not put false hopes in the horizon. My champion, of course, is Mr. L.K. Lee, a 40-year-old dog trainer, a bachelor who spent 8 years of his life training dogs for the Saudi police. I saw him 10 years back, walking into my outpatient clinic with bloated abdomen plus and bloated arms and bloated legs due to fluid retention. The bloated legs were so bad that I could see fluid oozing out from its pores. His left ventricular ejection fraction was in single digit, and his heart was bloated and hardly pumping as seen on the echocardiogram. Just last week, I saw him on his 3-monthly follow-up visit, looking very good. Mr. Lee, I did not tell you this, but when I saw you 10 years back, I mentally gave you only a month at the most to live. Myself trying hard to bring the question of mortality on the table. Doc, this Tuan Allah has been kind to me. I'm still able to train some dogs for a living, otherwise how can I pay your bill? Lee is still in this world and not ready yet, I thought to myself. My God, Mr. Lee, you make me feel guilty. Your drugs cost peanuts compared to those guys who had stents and angioplasty. For Lee, 10 years is a long time. Perhaps it is time I address his other heart, but political correctness and medical doctorum does not allow me that leeway, and he is obviously not ready yet. This is the stuff that keeps me awake at night, pondering whether I have done enough. Political correctness versus marhaba for a fellow man. It is not easy. You feel you have the alchemy and the secrets to happiness in this life and the hereafter, but you are not willing to share the secret with the rest. It is a responsibility we Muslims have to answer. P.S. Just saw Mr. Lee this morning at the clinic. Kaifaha Lee, how are you? Insha'Allah, Doc, Alhamdulillah. Still the cheerful Lee that I came to know 10 years back when he was just 47. He is now 57, now still training his German shepherds for some friends. Bila mau masuk Islam, Lee? Arab sudah pandai, I said half jokingly, half serious. Belum ready lah, Doc. I have a feeling of marhaba for Lee after all these years. He is my favorite patient, and why not? A left ventricular ejection fraction of only 8%, and still around after 10 years, 10 long years, a world record of sort. Subhanallah, walhamdulillah, wa la ilaha illallah, wallahu akbar, wa la hawla wa la quwwata illa billahil aliyyil azim, wa la hawla wa la quwwata illa billahil aliyyil azim.